If you have lupus, you're not just at risk for joint pain and skin rashes, you're at significantly higher risk for heart attacks and strokes as well. But there are steps you can take. Let's talk about how to protect your heart if you're living with lupus. Hello, this is Dr. Siddharth Tambar from Chicago Arthritis Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're diving deep into a topic that doesn't get enough attention in the lupus community: cardiovascular disease in people with lupus. Today, we'll explore the shocking heart disease risks in lupus patients, what the research actually says about this connection, how medications like Plaquenil, methotrexate, and biologics may impact your heart risk, the lifestyle steps you can take right now, and what blood tests can give you early warning signs. This is one of the most important conversations we can have if you're living with lupus or caring for someone who is. So how big is the cardiovascular risk associated in lupus? Lupus dramatically increases this cardiovascular risk. In fact, a study published in the New England Journal of Medicine found that women aged 35 to 44 with lupus were over 50 times more likely to suffer a heart attack than women the same age without lupus. A meta-analysis published in the Annals of the Rheumatic Diseases back in 2017 reviewed over 100 studies and confirmed a 2 to 10-fold increased risk of cardiovascular disease events, including stroke and coronary artery disease in lupus patients. The most common contributors include common systemic inflammation, accelerated atherosclerosis, endothelial dysfunction, and prothrombotic state, meaning more likely to clot, especially in people who have antiphospholipid antibodies. Even subclinical disease, meaning there are no obvious symptoms, can cause significant arterial plaque buildup visible on carotid ultrasound. So what does imaging and the lab data show? The carotid intima media thickness test is consistently higher in lupus patients, even young ones with plaque present at an early age. PET scans and MRI angiography have shown signs of vascular inflammation even in lupus patients without classic cardiovascular symptoms. Blood tests like CRP, interleukin-6, homocysteine, and Lp(a) levels are often elevated in lupus and are directly correlated with cardiovascular events. In a large study from the Johns Hopkins Lupus Center, patients with even mild lupus disease activity had high rates of arterial plaque and calcification. Let's discuss why traditional heart risk scores don't work very well for lupus. Most doctors use the Framingham risk score to estimate 10-year cardiovascular risk. The problem is that it dramatically underestimates risk in people with autoimmune diseases. This is because the Framingham score does not account for chronic inflammation, it ignores autoantibodies and medication effects, and it underweighs female risk even though lupus predominantly affects women. That's why rheumatology-specific tools like the Lupus Cardiovascular Risk Index are being developed, though they're not widely used yet in clinical care. Now let's talk about what role medications may play in cardiovascular risk. Hydroxychloroquine, also known as Plaquenil, improves lipid profiles, lowers your LDL, raises the HDL, reduces insulin resistance, and mildly reduces platelet aggregation, meaning less clotting. One major study showed a 70% reduction in thrombosis risk or clotting risk in lupus patients taking hydroxychloroquine. It's a foundation medication for many of our lupus patients, and it may help your heart as well. Now let's talk about methotrexate and conventional disease-modifying treatments. These are known to reduce systemic inflammation, and in rheumatoid arthritis, methotrexate has been shown to reduce cardiovascular mortality by 21%. While direct lupus-specific data is limited, the mechanism is likely carries over to lupus patients with joint involvement and systemic symptoms as well. Belimumab, also known as Benlysta, and rituximab, also known as Rituxan, can also be helpful here. Belimumab helps reduce B-cell activation and disease flares. A study in Lupus Science and Medicine in 2020 showed a reduction in atherosclerotic progression markers with belimumab therapy. Rituximab's cardiovascular impact is still being studied, but inflammation reduction is key. What's clear is lower disease activity in lupus means lower vascular inflammation, which long-term means less cardiovascular events. Then you've got steroids. This is a unique case. It's a double-edged sword, meaning short-term steroids may be needed during flare-ups, but long-term use can increase blood pressure, blood sugar, LDL cholesterol, and central obesity, all things that are connected with heart disease. Studies show that higher cumulative long-term steroid exposure correlates with higher cardiovascular events. So whenever possible, you want to use steroid-sparing approaches. That includes disease-modifying, anti-rheumatic drugs, biologic medications, and targeted lifestyle therapies for our lupus patients. So what lifestyle measures should you take? The same things that help manage inflammation and insulin resistance also protect your heart. Here's a core checklist most lupus patients should consider. An anti-inflammatory diet and nutrition. Emphasizing omega-3 fats, fish oil, flaxseed, walnuts. Avoid processed carbs and sugars. Increase colorful vegetables and fiber. Mediterranean diet in general has been shown to reduce cardiovascular disease risk, even in autoimmune conditions. Then there's exercise. You want to exercise regularly. A minimum of 150 minutes per week of moderate aerobic activity, and adding in strength training 2 times per week as well, at least. This can improve your insulin resistance and vascular health. It should go without saying, but avoid smoking. Smoking amplifies lupus flares and cardiovascular disease risk. It doubles the risk of clots and accelerates plaque formation. You also want to try to manage your stress. Cortisol and catecholamine spikes that occur with stress can worsen inflammation. Mindfulness and sleep hygiene can be key in this regard. So what labs should you be monitoring here? Along with your routine lupus labs, ask your doctor to monitor a high sensitivity CRP level, fasting insulin and fasting glucose levels, triglyceride to HDL ratio, LDL particle size, homocysteine, Lp(a). Vitamin D, low levels seem to be associated with cardiovascular disease risk as well. Even if your standard cholesterol panel is okay, these additional markers can detect risk earlier. Some frequently asked questions I hear from lupus patients. Should I be on a statin if I have lupus? The answer is maybe. If your LDL is high or you have known plaque disease in your arteries, then yes, you should consider that. If your inflammation is the only issue, then lifestyle and anti-inflammatory medications may be enough. Another question I hear is, can heart disease risk go down if my lupus is in remission? Yes, that's the good news. Lowering disease activity will reduce your vascular inflammation overall, and remission can be associated with lower risk of cardiovascular disease. And lastly, can I still exercise with joint pain? Lupus patients frequently will have pain issues. But the good news is that absolutely you should still try to stay physically active. Find activities that are tolerable, frequently lower impact exercises such as water aerobics, walking, light strength training. Anything you can do that keeps you physically active is good. Keep in mind that exercise and motion can be medicine as well. Let's sum it up. If you have lupus, your cardiovascular risk is real. But that's not the end of the story. With knowledge, proper medication, and the right lifestyle approaches, you can lower your risk significantly. Do not wait for a heart attack or stroke to realize your risk. You want to act now. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. And if you're living with lupus and want a personalized plan to reduce your inflammation and protect your heart, contact our office today to set up a consultation. Stay informed, stay strong, and as always, live well.